We have 1 to 2 cases a year for the last decade or so, but it's essentially, been wiped out here. The cases that we do see are, or have been, almost always imported from other countries where they're having outbreaks or where it's a more common disease, but here it's very, very rare because of our high levels of vaccination.
Was this measles case imported from another country?
This particular case I can't comment on, though I will say one of the problems now is that there's a big national outbreak. There have been over 550 cases so far this year in 20 states. So once it's becoming that widespread in other communities, it was almost inevitable that we would start seeing it here.
What concerns you, based on what you just said, with this one measles case?
Measles is one of the most infectious diseases that we know of and that we still deal with here. So it's very, very easy to spread compared to a lot of other diseases that scare us. So anytime that we see one case, there's a very good likelihood that we will continue to see others spread from that case.
What is the response from the state of Tennessee when there is a measles case?
The measles vaccine, which is widely available, is one of the most effective vaccines that we have. And therefore, the highest risk of spread from a case, once we identify it, is to unimmunized people. Now we have quite high rates of immunization across the state. It's a vaccine that everyone should get sort of with their childhood vaccines between 12 and 15 months, and then again before kindergarten. So the really high-risk groups are infants that haven't had a chance to be able to be vaccinated yet, or people that have cancer or other immunocompromising conditions. And they're really the ones that are at highest risk of getting the disease from people that have it. Unfortunately, in this national outbreak, the large majority of cases that we're seeing are from people who have chosen not to be vaccinated, which really puts the people around them at risk.
Do we know the percentage of people unvaccinated for measles in Tennessee?
Not precisely. It's probably in the single digits. There are lots of people that have had some vaccines and not others, so it's a little bit hard to keep, to have a perfect number. Really, our rates of people who have just completely refused vaccine is, under 2% or so, but it's unfortunately going up, and it's much higher in some of the communities in other states that are experiencing these big outbreaks.